When we think about hand pain, I usually like to think about three common causes of pain in the wrist and the hand. One is overuse injury, another is carpal tunnel syndrome, and finally arthritis. The bones in the wrist form a little bit of a dome-shaped structure. And so what happens is sometimes those bones can start to drop just a little bit. And as they drop, this space in between becomes more narrow. Because you see, the space isn't, there aren't really spaces in the body. So where we have this dome, across the bottom of the dome, we have tendons, and everything in between here is where the nerves run, it's where the tendons run. And so if we have any bones that aren't in place, and again, they tend to drop, then what happens is we start to lose what little precious space we have in that carpal tunnel region or in some of the other spaces that are in the wrist. So typically what I'm looking for is I want to make sure that each of the bones in the wrist are moving exactly as they should, and they're in as good of a spot as we can get them. That will help give us space. Sometimes prolotherapy can be helpful for this. We also want to make sure that the connective tissues and the fluids in that area are able to move freely. Remember that we have fluid that's always circulating in our body. We have blood, we have lymph, interstitial fluid, which is fluid that's between the cells, all types of different fluid that should be circulating in our body. When that fluid isn't able to flow, it starts to stagnate, right? Just like in nature, if a stream that should be flowing, if it gets blocked, it starts to pool up. Same thing can happen in the carpal tunnel. If the bones are out of place, if the tissues aren't draining, we can have extra fluid in that very small space that can then start to compress nerves. We actually do see this in pregnancy. It's not uncommon pregnant women get carpal tunnel. And so part of that is that fluid congestion, that increased fluid. So by keeping the bones in place, by working on the muscles and the connective tissues, we help move the blood, we help move those fluids, we help decompress that space, and hopefully give those nerves, the tendons, and the other structures in the wrist and hand and fingers the space that they need to function properly, allow the body to heal, and the pain goes away. In terms of self-exercises that you can do for the hand, again, usually my preference is to really target the exercise based on exactly what the problem is. But if you are having some type of overuse injury with your hand or carpal tunnel syndrome, one thing you can do is a 3-step exercise where you actually start with your fingers extended wide, and in the first step you just want to create a hook and then bring your fingers back straight up. For the second phase, we want to make a full fist and bring our fingers back up, and then finally we want to come down and keep straight fingers and then back up, and we can do that several times a day. What that will do is, it's a basic exercise that sometimes is done after hand surgery, but that will help keep those tendons that are running up the hand and down to the fingers. That'll help keep them mobile and can help sometimes just stretch the muscles and provide some very gentle work to help the area reset, move any fluids, help get some of the painful fluids out of there, and help the area to feel better.